Hi, folks. So I'm Dr. Roy with Associates of Integrative Medicine, and I want to talk to you about another form of genomic testing called Signatera. So genomic testing, again, helps us to identify the way that your tumor cells might be making mistakes. It's a type of gene testing, but it looks at the whole system rather than just one particular gene. Um, let's go back to talking about Signatera, though. So, one of the challenges of managing our patients in survivorship is it's really hard to know about risk of recurrence or recurrence. We have a robust surveillance program that's individualized and a little bit more robust, of course, than what oncology is traditionally doing. And we do have markers that we use in your blood right now, as many of you may know, that we're tracking over time to see if you're at risk of recurrence. So things like your SED rate, your LDH, specific cancer markers that are non-specific for cancer, but might point towards specific cancers like CA125, CEA, CA19-9. We also look at soft markers like platelet count and ferritin, and these are all excellent. They're far more obviously than what is traditionally done, and they give us a good sense about whether we need to be worried about our patients. And I'm happy to report that our patients rarely recur. But I'm always looking for other and better options, and there is leading edge technology now that allows us to do the following. We can take the pathology from or the sample, the original tissue that was removed when you had your original surgery. So usually if you had a breast, a colorectal, a lung, any of those kinds of cancers, when they originally diagnosed you, they either took that cancer out of your body or they took a piece of it. And when they did that, they hopefully usually keep it on ice for about 8 years. Um, at the time that they took it, depending on when you were first diagnosed, especially in the last couple of years, they likely did genomic testing on that tissue, which means they checked that tissue for what kinds of mistakes it might have been making at that time. But they may not have tailored your treatment, as we just talked about in the previous video, to those specific alterations. Now they've removed the cancer, they've treated the cancer, we've treated the cancer, and you're now cancer free. What we can do is take that original tissue still and create a test that's designed just for you that looks at 16 different clonal or original mutations from that original tissue, and then test in your bloodstream using that test for those mutations to see if they're showing up in your bloodstream at all. This is called minimal residual disease, or another term for it is circulating tumor cells. And it helps us to lower your risk of recurrence, because if we get a positive test, we can do some other things to aggressively alter your body's hospitality or environment for those cancer cells and then retest. And it gives us early warning signs about what we need to look out for so that you don't recur, or we can catch a recurrence early enough to cure. So those are the reasons we want to do this testing. And the great thing about this company, Signatera, is for now, they're covering the test through your insurance. And if they can't cover it through your insurance, they are eating the cost, which means that it's a low, no cost option for our patients. And obviously, to design an assay specifically for you on the original clonal mutations in your tissue is a very advanced test and costs the company a lot of money. So I'm excited. I'm excited for what they want to do and that we're able to make this available to our patients. Again, our practice will charge a nominal fee. I don't exactly know what that is, but you can talk to the front desk about it to process and read and research these tests for you. But It's something that I encourage all of my patients in survivorship, if they're at all worried about risk of recurrence, to do. Now, if you're not worried, or worrying or getting this test would make you worry unnecessarily, then we probably won't do it. It'll be a decision that you and I or your other doctors here and you will make, okay? Together. I hope this was helpful and informative. Let me know if you have any questions by emailing us at dr.roy@aimnatural.com. That's dr.roy@aimnatural.com. Or you can always go to our website at aimnatural.com and click on the contact us page. We'll talk with you soon. And until we do, be well.